everyone. Thank you for watching. Welcome to researchmd.com. We got a very important topic today. We're going to teach you all about number needed to treat. Again, my name is Pramil Cheriyath. I work as a Program Director, Department of Medicine, Internal Medicine, Transitional Residency. I'm also Director of Research. I'm also an Assistant Professor of Medicine at Hackensack School of Medicine. So today we are going to teach you all about number needed to treat. I wanted to bring you a story. What happened in 2017, pharmaceutical company Amgen came with a new drug called Repatha, and they did some studies and they found out it's very beneficial to prevent a heart attack and stroke. So it was even reported in the New York Times that this is a wonderful drug in the market and all that. So if you look at the drug very carefully, the drug claimed that it can decrease the heart attack and the stroke by 15 to 20%. But when you do the number needed to treat, it's actually you have to treat almost 67 people to get the benefit for one person, which a drug costs around $14,000 per year. So it's very important to find out, how to calculate the number needed to treat before we make some judgment of a drug. Now, okay, let's look at the definition. Number of patients who would need to be treated for one patient to benefit. The number needed to treat is the average number of patients who need to be treated to prevent one additional bad outcome. And the other important point is lower the number is better, okay? So the formula to treat is number needed to treat is 1 divided by absolute risk reduction. Always remember that, most important formula at all. Now, what is absolute risk reduction? It's the effect in the control group minus the effect in the treatment group, okay? And the absolute reduction is the difference in risk attributable to the intervention as compared to a placebo. Let's say you have a drug and you placebo, and you look at the effect in the drug minus the effect in the placebo, or the difference between them is the absolute risk reduction, okay? Always remember that. Now let's look at an example. You have a drug X and a drug, and you're going to study this drug X against the placebo to prevent heart attack. So you have two arms for the study. One is drug X and the other one is placebo to prevent heart attacks in a randomized group of participants. In drug X group, 3% has heart attack event, and in the placebo group we got like 8% have heart attack. Okay, so what is the absolute risk reduction? We have to look at the effect in the placebo and then minus effect in the drug group. So which is 8% minus 3%, so you get 5%. The next step is convert the 5% into decimal. So 5% means actually 0.05, correct? So now bring our formula. Number needed to treat is 1 divided by absolute risk reduction. That's equals to 1 divided by 0.05. So the answer is 20. So on average, we have to treat 20 patients with the drug X to prevent one heart attack. Always remember that, okay? Now, let's bring another. Now we're going to have a question, okay? It's an actual study published in Lancet. Rivaroxaban versus no anticoagulation for patients for post-discharge thromboprophylaxis after hospitalization for COVID-19. The study is actually called Michelle, an open-label, multi-center, randomized control trial. Okay, in the above study, there was 320 patients were randomly assigned to one is treatment group, which is a rivaroxaban group, and there is this control group or placebo group without anticoagulation. Now let's look at the results. 5 out of 159, 3.14% in the rivaroxaban group, and 15 out of 159 in our placebo group, which is 9.43%, developed the primary outcome, which is the pulmonary embolism, or like a venous thromboembolism. Now, please calculate the number needed to treat. Okay, now select the correct answer. We got option A is 10, option B is 16, option C is 20, and option D is 24. I'm going to please pause and do the calculation, and then we'll come back to it. Okay, now let's look at the answer. So we have absolute risk reduction. That's the first thing we have to calculate out, right? In the placebo group is 9.43%. In the rivaroxaban is 3.14%. So you took the difference. 9.43 minus 3.14%, we get 6.29%. Now the next thing is we convert that into decimal points, right? So that is 0.0629. So now we look at our formula. Number needed to treat equals to 1 divided by absolute risk reduction. That is 1 divided by 0.0629. So we get 16. Okay. So let's do one more example. In this study, we look at the effects of aspirin in the primary prevention in person with the diabetes mellitus. We got around 15,480 participants. So we got two arms. One is aspirin group and the other one is placebo group. Okay, and then we looked at the outcome. What is the outcome in this patient? We looked at the non-fatal myocardial infarction or cardiac event. So if you look at in the aspirin group, is the event was 658, which equals to 8.5%. In the placebo group, we got 9.6% or 743 people. Okay. Now, please calculate the number needed to treat. Select the correct answer. We got four options here. Option A is 85, option B is 88, option C 91, option D is 95. So please pause the screen for a few minutes. Please do the calculation. Okay. Now, the first thing we have to, what is the answer? We have to calculate is what? Absolute risk reduction. How do we do that? We look at the difference between the placebo group, the effect size in the placebo group, which is 9.6%, minus in the aspirin group, which is 8.5%. So we get 1.1%. 1.1%, we convert it into decimal, that's 0.011. So now bring our formula, number needed to treat is equals to 1 divided by absolute risk reduction. So we got 91, that's our answer, okay? Now, again, remember, the most important, this is the easiest formula. If you are in an exam or if you have to take a board exam, they're always going to ask you this question. Always remember, number needed to treat is what? 1 divided by absolute risk reduction. Okay. Thank you so much for watching. My name is Pramil Cheriyath, and we'll be back with another great video next time. Please help us subscribe to this channel so we can produce more videos like this. Okay. Thank you very much for joining us.